Hi, it's so great to be with you. My name is Vicki Noble, and I'm a doctor at Massachusetts General Hospital, and I'm an emergency doctor, which is why I was asked to talk to you guys. Um, I know you guys are at a very crucial point in the history of emergency medicine, and so I want to just give you some perspective and show you that you are not alone and that there has been a long history of fighting for emergency medicine in places around the country, and I can tell you specifically about the history in the United States to give you some perspective. But just to know that you guys have picked the most amazing job in the world, and it really is a privilege and an honor to practice medicine in such a pure form. So, with that, the lessons I'm going to talk to you about are that it takes time to develop emergency medicine. It's a phase shift for a lot of people to think about how to approach emergency medicine. And so, you have to be patient, which is, I know, very difficult. You can't compromise your core values. The more you compromise, the more you undermine what emergency medicine has to offer, and I'll give you some examples of that. Data makes change. This is true anywhere in the world, and I'll show you some brief data that we used in the United States, but you will be able to find this data in your own system because you guys know your system's strengths and weaknesses better than anyone. And when you know that, you know how to insert emergency medicine into those strengths and weaknesses to take advantage of them, I guess is one way to say it, and also to make sure that your system is developed to the best of its potential. So it takes time. This is one of my favorite physicians, and I don't know if you guys know anything about this guy. Dr. Larrey was a physician in 1786. He was actually born in 1766 in France. He joined the Navy, except that he was seasick all the time, and so he couldn't really participate in the Navy because of his seasickness, and he was such a terrible sailor. And so he switched over to the Army, and he actually really is credited with the development of trauma care and the idea of an ambulance service. So the picture there you see up here on the right or on the left, is a ambulance, and he was the first one to think of getting people from the battlefield to the rear hospitals and that time mattered. And so it was really the beginning of trauma care. It's amazing what he did. I mean, he was the first surgeon to treat battlefield casualties in the battlefield. He performed one of the first amputations. He did one of the first pericardiocenteses for pericardial tamponade. What else did he do? He just did like a million things. He was made a baron by Napoleon, and Napoleon, regardless of what you think of him, did say that he was one of the finest people he'd ever met. So anyway, this is the descendant of, or this is the ancestor of emergency medicine, and we should all feel privileged, to walk in his footsteps, really. In the United States, just to bring it back to the U.S., look at the difference, right? 1786, we had hospitals here. Mass General was instituted in 1811, and yet it took till 1961 for the first emergency medicine clinical practice to start in the United States. ACEP, which is our American College of Emergency Physicians, was formed in 1968. It was about 10 people big, so it was not very powerful. But where you guys are and where you should think of is that the first residency in the United States was at the University of Cincinnati, and it was formed in 1971. There are a few other departments that formed kind of close around then, LA County being one of them. But it took 9 years for a board to certify emergency medicine as a specialty practice in the United States. So, that's some perspective for you guys. Again, it took 34 years from the beginning of, if you go back to here, from the residency first residency to now, it's 34 years. But if you think back to the beginning when they first started practicing, it's almost 43 years. And that's insane if you think about it. That took a long time to get to where we are today. So you guys are just in the beginning of your fight, and I know that doesn't really help you very much, but you should think that you are in it for the long haul. And again, 43 years is a long time. So the pros and cons of being first, you guys are in an amazing position. They get to be creative. You get to define the practice, the scope of practice in Slovenia. It's an accomplishment. You know, you're kind of setting the tone for the way emergency medicine is going to be practiced. You have a small cohort, so in some ways that's such an exciting group to be in because you are pioneers and you are forging ahead despite all obstacles. And there are really no rules, which is kind of amazing, right? Like that's an amazing place to be when you're defining the scope of practice. Of course, there are cons. Of course, you know, I'm sure you've had the experience of people saying, what is emergency medicine? We don't need emergency medicine. We've practiced for hundreds of years without emergency medicine, and, you know, we're doing fine. You don't really have a home within the House of Medicine. It takes a while to develop a group of people who can establish mentors and kind of professionalism. So that takes some time. You get tired of fighting the same fights. I'm sure that over time your energy is sapped because you are always saying and arguing the same positions. And there's some uncertainty with this. You know, there is not a defined job path or guarantee that you're going to succeed. However, if you come later, there are also pros and cons. So, you know, from my position, where I have the luxury of being 40 years after the pioneers like yourselves, I have a precedent. So there is a reason why I exist and why I'm practicing emergency medicine the way I do. There is acceptance of the practice. People don't assume that there would be emergency medicine. There is some professionalism, so we have associate professors and professors, and there is a code of conduct to which we're expected to practice to that level. And there are standards. There are training guidelines and practice guidelines and lots of rules. And there is certainty. However, it's not quite as much fun to practice when you have all those rules and regulations. Again, rules have their own pluses and minuses, but, you know, there is less freedom and less creativity for sure. There's less room for individual impact. You guys are at a point where each one of you is going to impact generations of emergency physicians in Slovenia. And, you know, I may be lucky to impact the people who come to Mass General, but certainly I'm not going to impact generations and generations of people who spread the ideas of emergency medicine throughout our country. Okay. Also, you can't compromise core values. I think this is really important, and there's a few examples I want to talk to you about. I don't know if you guys know who this is. Dr. Semmelweis was a Hungarian physician. He was an early obstetrician, gynecologist, and he was watching women die of what was called then purpuric fever, or sepsis in childbirth. He was watching them die at rates anywhere from 10 to 30%, and people just accepted that. That was the norm. That was the way medicine was practiced, and he noticed that maybe there was something with contact or with washing hands, or somehow, I don't know what his spark was, but he decided that in his hospital he was going to have people wash their hands before they touched the patient, and not only wash their hands but wash them in a chlorine-based sort of antiseptic solution, and to clean all the instruments with this same solution. And he noted that in his hospital, mortality rates from this fever, or sepsis, as we now know, went from anywhere from 10 to 30% to almost 1%. Now that's an unbelievable impact. I mean, he must have just felt like this was so obvious to people that this was the right thing to do. And yet, he fought and fought and fought, and people said he was crazy, and they undermined him, and they told him it was not good. And he never lived, unfortunately, to see the fruits of his labor, because he died before he realized that everyone else knew he was right. And to me, that's probably... it's got to be one of the most frustrating lives to lead, when you know you're right and you know you have some knowledge that you're trying to share and people just don't understand. Again, Dr. Larry is another example of this. Here's a man who despite all odds, despite joining the Navy and being a chronic person with seasickness, he went on to develop all these surgical techniques for battlefield wounds. He performed the first pericardiocentesis for pericardial tamponade, and just really had an incredible impact on the way that we practice medicine, recognized not only by Napoleon, but by the Duke of Wellington, and by all the kind of heroes of his day. And so, if you go back and forth between these two men, poor Dr. Semmelweis, who had this incredible understanding of infectious disease before infectious disease was even a specialty, kind of died with failure and ignominy, whereas Dr. Larry, who came along kind of at the right time and was recognized by the right people, had this incredibly successful career. So the lesson for this is that no matter what, history will judge you by your righteousness. And so if you are right, which I believe emergency medicine is right, then it doesn't matter whether you're successful or not successful within your lifetime, because the history and generations of medicine and doctors to come will know what you did and what you did for the field. Of course, it's nicer to be successful during your lifetime. Okay, finally, data makes change. There are some great papers, and this is one from 2005, where in emergency medicine, we looked at emergency medicine residency programs, trauma hospitals that had those programs, which are the brown box plots, and trauma programs that did not have emergency medicine residency programs. And, not that we don't already know this intuitively, but if you train for something, you are better at that something. So if you train in a multidisciplinary fashion where you can manage airways, you can do chest tubes, you can do resuscitation, you can do central lines, you can do ultrasound, you are going to manage those patients not only with less complications, but less days in the hospital and even less death. And not that the death rate is, huge difference, but it is statistically significant. And so I think, articles like these can really help you make the case. There's also thousands of articles that have been written over the last 10 years about why emergency medicine is important. It's important because we do better in critical care. It's important because we are cheaper. It's important because we use radiology less. It's important because we are better at managing airway. Of course, I'm an ultrasound person, so it's important because we do ultrasound better. And of course, most importantly, it's important because an EM residency matters because we teach all of the above. And so that's why it's so important for you guys and for the futures of Slovenian medicine to have emergency medicine. Knowing your system's strengths and weaknesses, again, nobody's going to know this better than you guys. You're a small country, people know each other, so by forging personal relationships, you can lay the groundwork. You always want to be professional, you always want to, be right. It's always better to be right, but you want to just show that you care and that you're doing the right thing. And of course, you guys are a young specialty, and so the energy and the enthusiasm and the commitment of youth, it cannot be underestimated. The weaknesses are, pre-hospital medicine. If there's any weaknesses there, maybe that's an area where you guys can come in and own that and really make an impact there. If there are shortages, so there's not enough doctors, or there are people who don't want to work in emergency medicine, it's great to fill that vacuum. And again, sometimes youth can be a strength and a weakness, and there are many ways that you will want to use that to your advantage, but you do have to recognize that people are it's going to take longer to convince people of your seriousness and your professionalism, when you are a relatively new specialty. Finally, this is one of my favorite books, and I think the title is one of the most, kind of inspiring things, and the reason why most of us do emergency medicine. There are not many specialties where we train for this kind of a thing, where we train for anyone, anything, anytime. And really, that's what you're learning. You're learning to have any person, anything, any disease process at any time of the day walk through the door, and you give them the same quality of care. It's a very pure kind of very pure motive, and it really is a privilege. And I'll show you in a couple minutes some clips of emergency physicians from the United States who 10, 20, even 30 years into our practice still feel like we have the best job in the world.
What do I love about emergency medicine? I love the fact that somebody comes into my emergency department and they're an undifferentiated slab of humanity, and I need to figure out what's wrong with them, stabilize them, give them the appropriate treatment before they die. And I solve that puzzle over and over again at work. And to do that is the best thing about emergency medicine.
When someone needs it the most, I never know what I'm going to get when I come on shift, and I help immediately patients change their day around, either because they sprained their ankle or because they had a heart attack and a stroke. And I'm that specialist that turns them around when they're going to die, either medically or due to trauma. I'm the specialist who can turn that around. And I love what I do. And even more than that, I love who I do that with. We're a great bunch. We're a fun bunch. And we don't take life too seriously. We see that life is precious. We see it every single day. And we enjoy every second. I love being an emergency physician when people need it the most. I love what I do. And not many people can say that. Congratulations. You deserve it.
Emergency medicine is an incredible specialty where we get to solve real problems, life and death problems, every day, actually multiple times a shift. And I think it's amazing to be able to say, this is what I do, emergency medicine.
Emergency medicine is a challenging field where we're tasked with making decisions with limited information and establishing rapport with people quickly at a time of incredible vulnerability and need. And I'm still considering myself privileged to be able to practice this specialty, and wish you all the best of luck. Congratulations.